Hi, welcome to Dental Canvas. I am Dr. Gopal Kasat, and in this episode, we will be discussing the anatomy of the maxillary canine. Before going ahead, if you are new to this series, check the description or refer to the video on the top right corner to learn basic terminologies required for a better understanding of this video. Now, both maxillary and mandibular canine are referred to as the cornerstone of the dental arches. They are the longest teeth in the mouth, where the crowns are usually as long as those of the maxillary central incisor, and the roots being longest compared to any other teeth. The resemblance of this tooth with that of the carnivore's teeth give rise to the term canine. The incisal portion is thicker labiolingually than that of either incisor. This thickness provides reinforcement labiolingually to counter the force brought against it when in use. The crown portion of the canine are shaped in a manner that promotes cleanliness. The self-cleansing quality, along with the efficient anchorage in the jaws, tends to preserve this teeth throughout life. Along with these features and the bone ridge over the labial portion of the root, called the canine eminence, gives it a cosmetic value as well. They help form a foundation that ensures normal facial expression at the corners of the mouth. Efficiency in function, stability, and aid in maintaining natural facial expression makes them the most valuable teeth in anyone's mouth. Now, let us start with the labial surface of the maxillary right canine. From a labial view, the mesial half of the crown resembles a portion of an incisor, whereas the distal half resembles a portion of a premolar. This tooth compromises in the change from anterior to posterior teeth in the dental arch. The length of the crown cervico-incisally is 10 mm, which is almost equivalent to maxillary central incisor. Mesially, the outline of the crown may be convex or may have a slight concavity from the cervix to the center of the mesial contact area. The center of the contact area mesially is approximately at the junction of middle and incisal thirds of the crown. Distally, the outline of the crown is usually concave between the cervical line and the distal contact area. The distal contact area is usually at the center of the middle third of the crown. Mesodistal width of the crown at its widest region is about 7.5 mm. Mesodistal width of the crown at the cervix is about 5.5 mm. The cusp tip is on a line with the center of the root. This cusp has a mesial incisal ridge and a distal incisal ridge, the mesial slope being the shorter of the two. Both slopes show a tendency towards concavity before wear has taken place. The labial surface of the crown is smooth, with shallow depressions mesially and distally, dividing the three lobes, out of which the middle labial lobe shows much greater development and produces a ridge on the labial surface of the crown. A line drawn over the crest of this ridge, from the cervical line to the tip of the cusp, is curved mesially at its center. All areas mesial to the crest of this ridge exhibit convexity. Distally to the labial ridge, a tendency exists towards concavity at the cervical third of the crown, with convexity elsewhere. This can be appreciated from the incisal aspect. Now, let us move on to the root. The root of the maxillary canine appears slender from the labial aspect when compared with the bulk of the crown, and is conical in form with a bluntly pointed apex. It is not uncommon for this root to have a sharp curve in the vicinity of the apical third. The length of the root is 17 mm, which is usually the longest of any tooth with the possible exception of the mandibular canine, which may be as long. Now, let us move on to the lingual aspect. The crown and root are narrower lingually than labially, and the cervical line from the lingual aspect differs somewhat from the curvature found labially and shows a more even curvature. Various variations of the lingual side can be found with a varied rate of appearance. Usually, the cingulum is large and in some instances is pointed like a small cusp. In this type, definite ridges are found on the lingual surface of the crown, below the cingulum, and between strongly developed marginal ridges, although depressions are found between these ridge forms. Occasionally, well-developed lingual ridge is seen that is confluent with the cusp tip. This extends to a point near the cingulum. Shallow concavities are present between this ridge and the marginal ridges. They are called mesial and distal lingual fossa respectively. Sometimes the lingual surface of the canine is so smooth that fossa or minor ridges are difficult to distinguish. However, a tendency exists towards concavity where the fossa are usually found, and heavy marginal ridges with a well-formed cingulum can be appreciated. The lingual portion of the root of the maxillary canine is narrower than the labial portion, and because of this formation, much of the mesial and distal surface of the root is visible from the lingual aspect. Now, let us move on to the mesial aspect. The mesial aspect of the maxillary canine presents the outline of the functional form of an anterior tooth. The outline of the crown is wedge-shaped, the greatest measurement being at the cervical third and the wedge point being represented by the tip of the cusp. However, it generally shows greater bulk and greater labiolingual measurement than any of the other anterior teeth. The crest of the curvature is found at a level more incisal compared to incisors, as the middle labial and the middle lingual lobes are more highly developed. The entire labial outline from the mesial aspect exhibits more convexity than the maxillary incisors. The labial face is slightly convex from the crest of curvature at the cervical third to the tip of the cusp. The line usually becomes straighter as it approaches the cusp. The lingual outline of the crown from the mesial aspect is represented by a convex line describing the cingulum, followed by mesial marginal ridge, and becoming convex again in the incisal third. Labiolingual diameter of crown is 8 mm at its widest region. Labiolingual diameter of crown at cervix is 7 mm. The cervical line representing the cemento-enamel junction curves towards the cusp with a curvature of 2.5 mm. The mesial surface of the canine crown presents convexities at all points except for a small area above the contact area where the surface is concave and flat between the contact area and the cervical line. Now let us move on to the root. The outline of the root from this aspect is conical with a tapered or bluntly pointed apex. The root may curve labially towards the apical third with the labial outline of the root being almost perpendicular, with most of the taper appearing on the lingual side. Cusp tip is labial to a line bisecting the root of the maxillary canine, compared to a line bisecting the root of the central and lateral incisor, which also bisects the incisal ridge. This also works as a differentiating feature between maxillary and mandibular canine, in which the cusp tip is lingual to a line bisecting the root. Similarly, the distal aspect of the maxillary canine shows somewhat the same form as the mesial aspect. The curvature of the cervical line is 1.5 mm and the distal marginal ridge is heavier and more irregular in outline. The distal surface displays more concavity above the contact area and the developmental depression on the distal side of the root is more pronounced. Now let us move on to the incisal aspect. In general, the labiolingual dimensions is greater than the mesiodistal dimension. From this aspect, the tip of the cusp is labial to the center of the crown labiolingually and mesial to the center mesiodistally. If the tooth were to be sectioned labiolingually beginning at the center of the cusp of the crown, the two sections would show the root rather evenly bisected, with the mesial portion carrying a narrower portion of the crown mesiodistally than that carried by the distal section of the tooth. The mesial section shows a crown portion with a greater labiolingual bulk. The crown gives the impression of having the entire distal portion stretched to make contact with the first premolar. The ridge of the middle labial lobe is very noticeable labially from the incisal aspect. The cingulum makes up the cervical third of the crown lingually. Labiolingual taper can be appreciated from this aspect. A line bisecting the cusp and cusp ridges drawn in the mesiodistal direction is almost always straight and bisect the short arcs representative of mesial and distal contact areas. This completes all the 5 surfaces of the maxillary canine. To summarize it all, you can see an image on the screen with all the average dimensions and key features. To download the same and see our resources, check the description. If you have learned something, hit the like button and feel free to subscribe. Looking forward to your comments. Thanks for watching. I am Dr. Gopal and you have been watching Dental Canvas. See you all in the next one.